Hi, I'm Dr. Ronan Collins. I'm a consultant geriatrician and director of the stroke service in Tallaght Hospital, a teaching hospital of Trinity College Dublin in southwest uh, Dublin City. We're delighted to be involved with the STINT project, and indeed our first intern has come all the way from Montana in the United States of America, Miss Elizabeth Miller, and we're delighted to have Elizabeth, who is a biology major in Helena in Montana. So one of the, I suppose, key objectives we wanted to share with Elizabeth, number one, I know she's keen on doing medicine, so we wanted to share with her, number one, some experiences of what medicine involves, both as a career and as a job, and what a working life would be as a physician, and what kind of basic skills you need in terms of basic sciences and understanding of the sciences, how we apply the basic sciences she's studying in college in terms of the assessment and treatment of patients, and in the assessment of physiological parameters. And of course Elizabeth then is also helping us very fundamentally with a project looking at the care pathway of acute stroke presentation to the hospital. One of the key and I suppose most important factors in determining outcome in stroke is the speed to treatment when a stroke patient arrives in the hospital. And obviously, just to summarise, that involves several steps. Patient presenting to the emergency department, patient being assessed by a doctor, patient getting time to the CT scanner, patient's blood's been sent and waiting the results to come back. And so all those individual steps themselves involve a period of time elapsing. And one of the things we're conscious of is that we're continuously trying to shorten that time period. So Elizabeth has been studying that for us, looking at a period of 3 months in the last year, to see what our time pathway looked like in acute stroke presentations. And once we've all this project compiled, we will then have a better understanding of how much time each step takes and where we could possibly make improvements, with the goal of obviously getting faster treatment and getting better outcomes all the time. So it's a very well worthwhile project. It has both practical implications for acute stroke patients. It has practical implications for us as a department in looking at outcomes and getting better outcomes for patients, and therefore reduced lengths of stay, etc. And obviously has a very practical educational, if you like, goal for Elizabeth herself, and both understanding how we measure, process, and how we do audit in improving medical treatments and medical pathways. So we hope Elizabeth has enjoyed it. We've enjoyed having her here as part of the STINT project in Tallaght Hospital in Dublin, and hopefully she'll get a good publication out of it also.